And I'm so excited for us to present to you with this cutting-edge technology that we've been collaborating on. This is the surgery as ceremony process. My name is Dr. Kat Meyer. I'm a licensed psychotherapist, and I specialize in trauma, sex therapy, and women's health.
And hello, I'm Dr. John Kanevsky. I'm a board-certified plastic surgeon, and we're going to share with you a little bit about the process and protocol known as surgery as ceremony.
So you probably heard those two words, surgery and ceremony. And I think most of us think of ceremony as sitting in a circle, doing ayahuasca. But this is in a medical office, and this is ceremony? So maybe we start there with that. How do you see ceremony, and how do you see that integrate with the surgery?
Yeah, so surgery and ceremony are actually linked in more ways than might seem obvious, but there's three ways that I think that surgery and ceremony are basically inherently similar. The first is that both in surgery and ceremony being either, it's anything that's done with a real intentional process of transformation. So it could be anything from a meditation retreat to a plant medicine ceremony. So the first way that surgery and ceremony are similar is that there's a desire or an intention to transform. So with surgery being a physical transformation of the body, and a ceremony being, more the metaphysical or psychological transformation. So that's the first. The second is that there's usually an altered or elevated state of consciousness. In the meditation setting, it's the dedication to the practice. In the plant medicine journey, it's the actual medicine itself. And in surgery, it's the powerful anesthetics that are used. And the final similarity between surgery and ceremony is that no matter what the set or setting is, you have to go through the journey. You have to go through the process, whether it's the meditation retreat, the plant medicine journey, or the surgery itself. So desire to transform, elevated, altered state of consciousness, and undergoing the journey.
Yeah, you can't just skip to the end, right?
Yeah.
You can't just skip to the outcome. You got to go through the process, which makes a lot of sense. So when we were in the Serengeti, one of the elements of being on that land and talking to some of the guides was fascinating to hear about their process with medicine and the plants, and really the ritual that they put around treating the individuals. And so that really brought me into this mindset of ritual in medicine.
Yeah, so it's only in the past, I'd say 5-6 decades that the ritual side of medicine has sort of been extracted. And we view allopathic Western medicine as a very functional, kind of sterile process. But if you look back in traditions, as far as 1000 BC, there's texts out there that show detailed descriptions of ritual being actually very much part of what we think of medical processes. And fast forward to modern day, we're still doing these rituals, but we just don't think about them that way, especially in the operating room. Surgeons will wash their hands a certain way before they do a procedure. Patients will fast before they have a surgery. You wear certain clothes. When the patient's brought into the operating room, there's a certain script that's read. It's like a timeout, almost like an incantation. Those steps are very functional, but they still have a ritualistic process behind them, and that's no different than any other ritual that's being performed. A great representation of that I heard is, what is a protocol but a process but a ritual, and a ritual but a ceremony. So it's just about anything that has these steps, the intention that we put behind them.
And putting the conscious awareness into something that we would otherwise feel is mundane. Ritual really transforms an experience. We have coffee in the morning. What transforms it into the ritual is the conscious awareness of it, the breathing it in, the knowing the intention of why we're doing this, versus just the unconscious habit that we fall into. So as we're describing this particular process that you've developed, can you take us through the steps of this, and then we can break those down and share with everybody what that looks like?
Yeah, sure. So surgery ceremony is 3 steps, a three-part process that happens over the course of 3 weeks. So patients will have a ketamine-assisted psychotherapy session with a therapist, such as Dr. Kat. Then that will be followed by the actual surgery process itself with me And I take patients through an awake or conscious sedation surgery. So the surgery I do is mostly aesthetic, there's some reconstructive aspects to it, but it's moving fat around the body for reconstruction of the breast. And that's done awake with ketamine. And then the last step, which happens usually the third week or about a week after surgery, is body work. So it's a certified lymphatic therapist who grounds the somatic experience of landing in the new body.
And so the first part of this is my part. So this first aspect, and you created a model called Seed, Bloom, Thrive. And so Seed is where I come in as a psychotherapist. And this process is the important process before this surgery to prepare a client to go through this transformation. I'm helping with connecting the psyche with the body. So this looks like a first prep session where I'm talking with the client, I'm preparing them with what to expect before the ketamine session, talking to them about the concept of intention setting, and then also giving them the first steps of how to reconnect with the body and develop that relationship with the body. Then we go into the ketamine session, which is about 2 hours long, and we go through the process of using that intention, set to a curated music playlist that guides them on this journey, and then ending with an integration session. So that means that we're taking everything that came up in this experience and transforming the symbolism, understanding the experience, the embodied experience, what happened in the mind, and primarily I'm looking for 3 different things to help a client. First, I'm helping them to get clarity on their why. Why am I coming to do a surgery? Why am I doing this elective surgery? And anytime that we're going into this, into a surgery, there can be so many different parts of us that are in conflict with one another. You know, there may be a part of us that really wants to have, a part of our body modified, or perhaps a client went through breast cancer, and so now has this trauma of this past experience with their body. And so, or peer pressure, or some of the pressures from social media, or even just in our own upbringing. So having the clarity of these parts that might be in conflict with one another helps to alleviate some of the anxiety and some of the uncertainty that they might have moving forward. Then I also want to help them to identify resourcing. So resourcing are tools that help us to be able to regulate our nervous system if we get anxious, or if we get dysregulated, or if we're feeling alone. Some of these resources can be a mantra that a person experiences in the ketamine experience, or it may be a word, or it may be a somatic experience. And so at any time in the surgery, they can invoke these resourcing to be able to help them to be able to come back into calmness as they proceed with the surgery. And then the last piece is to be able to, again, help them to start to develop a relationship with their body. Many of us have challenging relationships with our body. And so we, as a result, could have cut off from different parts of our body, especially if it's a part of us that we didn't like. We don't want our conscious awareness in the presence of our belly, or our nose, or our breasts, or we might be hyper-focused on it because we're afraid that it's going to cause rejection, or it's going to be something that causes us social pain. So this ketamine helps to lift some of the heaviness of the anxiety, or some of these parts that might get in the way, so that we can get better clarity. And what I love about ketamine versus talk therapy for this particular process is that it's a lot more efficient. You know, we can create that clarity quicker. It can allow the clients to be able to have the reference points of what it's like to feel clear, and what it's like to feel in a space of self-compassion and patience, which are all really important qualities if we're considering going through a process that's like surgery. So once they feel complete, or once they have these tools, then I pass them over to Dr. K for the next process, which is the bloom process of surgery.
So the concept of integrating psychotherapy and surgery is not entirely new, but this way is new. So having a patient have the experience and opportunity to get clear on their why they're doing a procedure, set intentions, and also address any fear, anxiety, or past traumas before surgery is what's really novel and special about this. So when I see my patients again after they've had therapy, they're loaded up with tools that they can use during the procedure. And because I do the surgery awake, it's a chance to recall and get really clear on the intention, but also use that as an opportunity to really create lasting transformation. So the surgery itself, the parts of it that are like a ceremony are from the moment I see them in the pre-op room, first thing in the morning, we drop in, we do a little meditation together. I already have some debrief from their therapy session, so I understand some of the finer, more granular points that maybe they wouldn't disclose to me, but can get from a therapy session. And then we can really set an intention together about how they want to feel and embody their new self once they've healed and recovered from the surgery. When we go into the operating room, that's where the ceremony really begins. So it's not your traditional OR. It's still a medical environment, so it's somewhat clean and sterile, or it is clean and sterile, but it's not like, there's accents that are made to look and feel more like a ceremony setting. So I use a combination of sound, vibration, and lighting to really bring patients through an experience. I use the same playlist that they have during the ketamine therapy session, so that's a really important part for neuroacoustic recall and helping continue a cathartic experience.
Curated by me, so it's really good. I promise.
Then I use blindfolds. I use vibrating touch points, which it's from EMDR therapy. It's a concept that allows activation of the parasympathetic nervous system to further help calm and help patients regulate their any anxiety they have. And then the actual ceremony begins with an infusion of ketamine. So I use ketamine as the anesthetic, one of the local anesthetics as part of the procedure. And ketamine happens to be a really ideal anesthetic in the surgery setting for awake or local procedures because, first of all, it's been tried and tested for decades. So a lot of people think, oh, is this legal? Are you allowed to do this? Yes. Ketamine has been used as an anesthetic in the medical setting for decades. It's got a really favorable safety profile. Still important to be aware of its side effects and consequences, but it's one of the safer medications out there for awake procedures. I use, with the dosing I use, I'm able to really guide patients into as deep as they want to go based on their experience. But the idea is to create a comfortable dissociated state where I can still talk to them and still interact with them, but they are really on a journey. And so for the first 20 to 25 minutes, we're basically just sitting together, letting the music do its work, and I'm using some of the key words that they brought up in therapy to help bring back the setting of the attention and the vision of where they want to be once they're recovered. And after the first 20 to 25 minutes, the patients are usually comfortable enough, and I can go ahead and start the procedure. And surgery lasts anywhere from 1 to 2 hours, depending on the procedure. And then it's amazing to see the kind of transformations that happen, even on the table, like the sort of recall I get. I'm able to be present and talk with the patients. If they have a cathartic release, I can hold a space for them. So that's really the ceremony part of the surgery piece. And then it transitions from there into the last part after surgery, which is the body work and recovery. And I call that Thrive. But the idea is really to ground the somatic experience. So much about touch and feeling your body is important after surgery, especially when you're anticipating pain and the nervous system is amped up. It's wired to be hypersensitive to pain. So having somebody who's a lymphatic therapist really touch and hold and create a space where your body can be held really helps patients feel more grounded in the experience.
Yeah, and I think the integration aspect is really important. Me being a psychotherapist on his team, I can be there for the client both before and after, especially considering sometimes things come up in the surgery session as well. So to have the option to be able to work with me, to be able to understand and integrate that experience, it helps the client to feel held the entire way through, which is what we want. We want you to be held. The ceremony is held by a container. And so as we're talking about plastic surgery, there's a lot of stigma that can come up around that word. And maybe let's speak to the stigma that we hear and how this might relate to some of our clients or even to some of our audience members.
Yeah, sure. So most of my patients are female and patients that have had either a history of breast cancer or are looking to do some sort of aesthetic modification to the body, but don't want breast implants. And there's a lot of stigma associated with wanting to change your body, and fear and anxiety that patients come in saying, oh, I don't want to tell anybody I'm doing this, or I've heard, like I never thought I'd be doing this. And so patients come in already with this sort of preconceived notions about how their body autonomy could be judged. And I always remind myself and guide patients through the discussion, which is, there's two sides to the coin. There's body autonomy, which is we all have the right to do to our bodies as safely as possible what we choose and want to do. And also acknowledging that there's societal pressures to feel and look a certain way. And on the other side of that is the truth that, the more confident you feel, or the more satisfied or in line your physical appearance is with the body that you imagine you want to have, the more confident you feel and the more you can show up in the world. So in that, somewhere in there between the societal pressures and wanting to feel and look a certain way, there's definitely a stigma, and I think it's important to discuss. And I think having this kind of therapeutic component helps patients address any of those fears or anxieties.
Yeah, and I would say in some of the conversations, as women, we can also hear this hierarchy of natural. If you are natural and you've done nothing to yourself, then you're somehow some more better person or moral person, and we're supposed to self-love. We're supposed to self-accept our body as exactly as it is, and that is also really challenging to do. And so not to be able to hold space for the agency of each individual for their own body. What decisions do I want to make for my own body? And that's why I think the ketamine is really powerful, because it encourages the inner healer. Rather than us putting any sort of further pressure or expectation on a person, but allowing them to come to their own decisions. We're actually not attached to whether they end up wanting to do the surgery or not. We encourage them to come to their own decision themselves. And so as we have these conversations and bring into reality that even this idea of hierarchy of natural is quote unquote better is also just a perspective. And so in ketamine, I get to help the clients, whose voice is this coming from? And is this something that is important to me? Or is this from somebody else that I've allowed to shame myself for how I want to be with and celebrate and experience life in my own body?
So some of the feedback experiences and things I witness with patients is starting with the therapy. I have patients regularly messaging me saying, all of my worries or fear about this procedure is gone. I finally feel like I can accept my body. I'm so excited for this procedure. I feel like my life's already changed and I haven't even done the procedure yet. And then to go from there into surgery and be able to use some of those same intentions and resources that patients pick up in therapy, it just further compounds the experience. And so from the surgery standpoint, or clinically, I've noticed that patients tend to take less pain medication after surgery. They get back to their daily activities faster. And also, they just have generally kind of like a more elevated mood after the procedure. So I think all in all, this is anecdotal. I haven't done a full, I'd say quantitative study on it, but just objectively what I'm noticing on patients who go through this protocol is that they generally have a much better outlook on their recovery and their outcome. And it's interesting because the way ketamine has been studied is that if you do it consistently over the course of 3 weeks, it shows that it has these long-lasting neuro benefits. So psychologically helpful for fear, anxiety, trauma, post-traumatic stress.
Yeah, and what we've even seen and what we're continuing to learn is some of the patients coming in, if they have trauma, that's something that we want to take particularly care through this process, and then even check in with them and hold space for them after the procedure. So we're even learning from these testimonials of the patients, what their inner process has been like. Many of them have reported feeling a lot more sensual. They want to connect with their body, which is what we want. We want individuals to enjoy life in their body. And if this is a tool that they discover works for them, we're so excited to provide that for them. So as we're talking about this, and then thinking about where this can go, let's talk about future ideas for this.
Yeah, so, I'm working in my own little bubble of just the plastic surgery world, but there's something close to about 300 million surgeries around the world a year. And if you think about that as a once-in-a-lifetime chance for most people have surgery anywhere from 1 to 3 times in their lifetime. If every one of those moments where you are going to go under and have this major transformational shift in your body accompanied with anesthesia could be viewed as an opportunity to create transformation of not just the body, but also the mind, that's a massive impact. 300 million people a year, even if it was 1% of that, that's a lot of people getting more psychological support and treating what we think is a pretty sterile medical process as actually a transformational shift. I think of it the same way as any ceremony that people would go under. There's integration, there's support before, there's the procedure and integration afterwards. And so my hope or vision is that this kind of intention could be brought to not just plastic surgery procedures, but other surgical specialties. Maybe for other elective procedures, whether it's joint surgery or heart surgery, brain surgery, cancer surgery. These are every one of those patients has a psychological association with what's happening to their body. They are walking around with joint pain, a heart that's not working properly, or fear of a tumor growing in their body. And there's a powerful psychological component with that can also create a lot of healing and release if only we could do this kind of ceremony in other surgical specialties. So my future vision is that, I hope that other surgeons, other medical practitioners would start to incorporate this concept of what's the intention behind the procedure and what's the transformation that can happen with it.
And I would like to see more of a conversation about the therapy supporting any sort of surgery, but especially elective surgeries. Why do we keep seeing people cycling back to get more and more done, more and more quote unquote fixed about themselves? And I think it's because of a lack of conscious awareness and a lack of integration. And they just keep chasing after something to modify the body to fix what's inside. Perhaps a part of them that struggles with self-love or struggles with pain, some sort of emotional pain. And so we want to encourage, this is why we encourage the integration and the prep to be able to reduce that chasing. Anything else?
Oh,
Should we, any questions? Anybody? We've got a few minutes left.
any questions? Okay, here we go.
Yeah.
For knee surgery, do you have any others? Do you know of other surgeons who do this kind of? There we go. Do you know other surgeons who do this type of ceremony yet, or you
No.
feel like
I've met a few colleagues that do work with therapists, but it's more for sort of medical legal purposes to screen patients before, but I haven't come across anybody that does it like this. Yeah.
Thank you for what you do.
Hopefully soon. I mean, I would say this is one of the first public forums that I've talked about this. I've spoken to a few doctor panels before, but this is the first time kind of getting the word out and sharing some of the experience.
Woo! One more question? Anyone? All right.
Okay.
Please thank both beautiful humans on stage, Kat and Jonathan. Thank you so much for your expertise.